The legitimate indications of cannabis. First, glaucoma. It actually can reduce the intraocular pressure in normal subjects for 24% by smoking a marijuana cigarette, but the reduction of IOP can be sustained. Second, HIV/AIDS. It can actually prevent the wasting syndrome and also control the nausea and vomiting caused by medications. The third is cancer. Cannabis is helpful in controlling the extreme nausea and vomiting that often accompanies cancer chemotherapy. The fourth one is multiple sclerosis as an antispasm and analgesic medication in patients with multiple sclerosis. Alternative antidepressant can be divided into two, pharmacological and non-pharmacological. Pharmacological are St. John's wort, 5-hydroxytryptophan, S-adenosylmethionine. Non-pharmacological are cognitive behavioral therapy, exercise, acupuncture. St. John's wort, a plant that grows in the wild, has been used for centuries for mental health conditions. It's widely prescribed for depression in Europe. Combining St. John's wort with certain antidepressants can lead to potentially life-threatening increase of serotonin. According to Linne et al. 2005, St. John's wort can influence adverse effects of other drugs. Patients should consult their physicians before using St. John's wort. 5-hydroxytryptophan, 5-HTP, is a precursor to serotonin, the neurotransmitter sometimes thought to be responsible for happiness. It causes an increase in satiety without a concomitant decrease in appetite. 5-HTP can cause a significant reduction in carbohydrate and fat intake as well as body weight reduction. Thus, the 5-HTP should not be taken with any neurological drug that has been prescribed for antidepressant unless cleared by a medical doctor. S-adenosylmethionine (SAM). Lower SAM level is associated with depressive symptoms and supplementation may aid a partial deficiency. According to Sharma et al. 2017, it is found promising but limited evidence of efficacy and safety to support the use of SAM as a monotherapy and as an augmentation for other antidepressants. Cognitive behavioral therapy (CBT) is a talking therapy between a therapist and a patient. It can change the way patients think and behave, but the disadvantage is it needs the patient's commitment. Exercise. Researchers have found that regular exercise and the increase in physical fitness that results alter serotonin levels in the brain and leads to improved mood and feelings of well-being. But according to one clinical review article reported by Cooney et al. 2014, the association between depression and exercise may be insignificant. Acupuncture. What are the positive effects? It can promote the relaxation and deactivating the analytical brain, which is responsible for anxiety and worry. It can also increase the serotonin level as well as endorphins. Now class, together we think, which alternative among the previous antidepressants would you recommend to Miss D? Is it St. John's wort? No, because it's Miss D case, Miss D is already prescribed with citalopram. Combining the St. John's wort with other antidepressant drugs can lead to potentially life-threatening increase of serotonin. Is it 5-HTP? Miss D has poor appetite with subjective weight loss of 4 kg. 5-HTP can cause a significant reduction in carbohydrate and fat intake as well as body weight reduction, according to Changiano et al. 1998. So 5-HTP is a no. How about S-adenosylmethionine (SAM)? It is actually less suitable as the evidence of the safety and efficacy of SAM are still limited. What do you think about cognitive behavioral therapy (CBT)? In the case study, Ms. T was referred to an outpatient substance abuse program, but she declined to attend. Ms. T has a problem to commit to an outpatient substance abuse program. Furthermore, this CBT program requires commitment from patient herself. Exercise is good, but in one clinical review article reported by Cooney et al. 2014, meta-analysis suggests that association between depression and exercise are favorable, but may be insignificant due to risk of bias. Then how about acupuncture? Studies indicate that acupuncture can alter the brain's mood chemistry, increase serotonin and endorphins. It also can reduce sensitivity to pain and stress, as well as promote relaxation, deactivate the analytical brain, which is responsible for anxiety and worry. So acupuncture is a yay!